You're most welcome for this session. Today we are going to demonstrate how to take the blood pressure of the patient, and you can take in two different ways. One, you can take when the patient is in a lying position, and then you can also take when the patient is sitting. So we are going to start with the one when the patient is lying on the bed. So we are going to explain our procedure to the patient. Good evening. How are you today?
I'm a bit fair.
Okay, that is good. So now, I've come here to help you check how the blood is flowing in your body. Doctor wanted to know. Yesterday it was okay, but still we want to check today to see whether it is okay. So let me prepare and then I come back, okay? Thank you. Before the procedure, we are going to start with the hand washing. Okay. I put on the apron to protect myself. Then I put on the gloves. Okay. So this is my requirement. So let's go. Help me with this hand. So before you put the DP machine, you first fold the clothes of the patient, and then you place the cuff. Put the hand down. So after you feel for the pulse, the radial pulse, such that you'll be able to place the stethoscope, fingertips. Then you place your stethoscope where you have felt the pulse, and then you start inflating. After, you start releasing slowly. Then after, you give the feedback to the patient, and then you record on the patient chart. So Bosco, your blood pressure is okay. It is 100 out of 60, which is really normal. Thank you so much for cooperating.
Thank you.
Thank you.